So
Tell us when.
I am so tired of eating leftovers.
Do you need food?
Yeah.
Yeah? Okay.
Like one of those farmer double stack wraps would go nuts right now.
Yeah, we're gonna get one of those.
Bidding! Purple!
Also, we got a purple call.
What
does that mean?
All right, so Sarah, as you can see, we got a purple call. That's a life-threatening call.
Okay.
Most likely going to be cardiac arrest. Do you know anything about cardiac arrest?
I actually do know a lot
Cool.
because I'm in school.
Nice.
Yeah.
Yeah, so cardiac arrest stops your heart usually.
Yeah.
What does that cause?
When it stops your heart, you're basically dead.
Oh, okay. Yeah, why though? Why do you die?
Oh, okay. So you die because your heart is not beating and circulating oxygen to your brain and your tissues, and caused by respiratory arrest.
Okay.
Yeah. So I think I've learned that this can happen in many different ways, like the causes of it.
Totally.
There can be like an electrical disruption in your heart, mechanical failure, so your heart muscles stop pumping, or oxygen deprivation due to respiratory arrest and hypoxia, cellular damage, and inflammatory response. So any like blocks of the coronary arteries in the heart, or
So, unfortunately for us, none of those are treatable for us. But what we can treat is hypovolemia. Do you know how we treat hypovolemia?
I'm pretty sure you try to give them some normal saline
Yeah,
through
you
an IV.
add fluids to increase pressure.
Yeah. What happens if an IV doesn't work?
We actually just got this new technique called interosseous. Do you know anything about that?
Okay, I've heard about it. It looks super scary.
It is scary. It's a
Yeah.
drill. It's scary for sure. But as
Yeah.
long as you walk your patient through it, everything will be fine. So what it is we drill into the bone. We have certain landmarks that we'll discuss later. But
Okay.
what we do is we drill into the bone so we have a nice access straight to their circulatory system.
Nice.
Yeah, bypasses if we can't get an IV
Yeah.
in.
And I'm pretty sure, do you know the rhythms that you can shock a person in cardiac arrest with?
Yeah, so we have VTAC pulseless
Mm-hmm.
and VFib. Do you know what either of those are?
I think VFib is like, it looks like shark waves or something.
Yeah.
And what about if there's no heartbeat, like asystole?
Yeah, so that's not a shockable rhythm. So unfortunately for that patient, we'd be calling a doctor and getting orders.
And PEA, I've heard of that one too. Can you shock that one?
No, unfortunately the only two shockable rhythms we have are pulseless VTAC and VFib.
Ah, dang it.
And scene. Thanks for coming. My brother, he's not breathing and he's just down the hall.
All right, we're here to help you. Okay.
My brother, he's down the hall. He's over here. He's over here. Just in this room.
Hey there, we're paramedics at BCHS. Can you hear us today? Hey, we're paramedics at BCHS. Can you hear us today? Nope. Okay, cap check. Okay, he's pulseless. I'm not seeing any breath. Can we get him to the ground quick?
Yep.
Grab his legs over, you move. Okay, 3, 2, 1. Down. Nice, okay. Can you get you on the chest right away?
Yep.
Okay, sweet. Okay, I'm seeing some fluids in the mouth here. I'm gonna grab the AED while you're there.
What can I do?
Oh, hey, Fire, can you get on the chest there for me?
Yeah.
Carly, do you mind getting suction and an OPA ready?
Of course.
Thank you. The AED pad's coming in here, Fire.
It's actually for 15 seconds as far as I can see.
One more. See, that's nice.
They're right there.
I'm gonna analyze. Analyzing heart rhythm. No shock advised. Can you get back on the chest, please? Okay, let's get these bags going. Get that OPA in, please.
Measuring.
Get your oxygen set up.
Yep. Repeat in.
Awesome. See that worked? How's those compressions going, Fire?
They're good.
Okay. You know if you need a break, swap out, okay? 15 LPM. Okay, how's those vents? I'm not too happy with those. Can we go for an eye gel, please? I'll grab one for you. Continue venting.
Oh yeah.
And I would lubricate. Heck out of this. This is lubricating. Are you doing there, Fire? You okay?
Yep.
Okay, 30 and 2. Don't forget.
30.
Awesome.
1,
As those
2.
go in, pull that off for me. Just being patient, sliding an eye gel in unlubricated. Okay. Eye gel accepted. We've put suction tubing through there. Due to us not having lubricant, we were not able to put it in today. But we generally would to prevent any vomit or blood from the chest compressions. At this point, I'm going to RBS.
I'm gonna do 30.
I'm going to start at the top here.
You're just
Okay.
continuous
I'm gonna check the carotid over here. Okay. You mind hopping off the chest for me just for 2 seconds? I'm gonna check the carotid. Yeah, no pulse found still. Keep going. Full RBS. Pelvis stable, 4 quadrants stable. Chest is unstable at this point due to pushing. No blood, no swelling, no deformities found. This is just a cardiac chest call.
26, 27, 28, 29, 30.
Breaths in.
Keep on fire.
1, 2.
Okay, we're gonna analyze again. Analyze.
No shock advised.
All right, that's 3 no shocks. I'm gonna call EPOS. Just carry on CPR, please. Hey, this is Ty with BCAHS. I'm a paramedic. We've been on a cardiac arrest call for the past 10 minutes. We've gotten 3 no shock advised, and I'm just looking for discontinue orders.
Okay, sounds good. Did you try blah 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 blah?
Yeah,
Oh, what about blah 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 blah?
yeah, we tried everything.
Oh, okay. Well, it sounds like you've tried everything. So thank you for your guys' attempt. Unfortunate for the patient, but you have my authorization to continue with discontinuation orders. Please follow your protocol and have a good day.
All right, you as well. Thank you.
Bye.
Okay, I just got off the phone with the doctor. We've got discontinuation orders. I'm gonna listen for return of spontaneous circulation. Please get off the chest. Thank you. Confirmed no signs of life. We can call it there.
Whoa! Okay, we're going to talk about CPR and the importance. We want early defibrillation and application of AED. Good compressions with good chest recoil at 110 to 120 beats per minute. After 2 minutes, we want to switch the person doing compressions, and our landmark is at the sternal body, avoiding the xiphoid process. Ventilations are, without a supraglottic airway, are 30 to 2. So compressions 30, ventilations 2. We can apply the supraglottic airway ideally at the 3rd cycle of compressions, and we can ventilate 5 to 6 seconds while compressions are going on. And tidal CO2 is target during CPR is 10 to 20 millimeters of mercury. After discontinuation protocol, doctor will ask if you checked for ROSC. So that would be checking the pupils, ECG rhythms, heart and lung sounds through auscultation by both paramedics.
And here we have the heart rhythms. This is a normal sinus rhythm. This is what your heart looks like right now, hopefully. Ventricular fibrillation is when your ventricles are essentially freaking out and misfiring. Ventricular tachycardia is when the ventricles are going too quick. Asystole is what we call flatline, and PEA is pulse electrical activity, where there is still electrical activity, but there's no pulse.
What are the 2 shockable rhythms?
That would be these 2, VTAC and VFib.
Okay. Thanks,
Yeah.
team.
You're welcome.
Go.
Wow. hypovolemic cardiac arrest. That means there's no fluid in the system. We need to perforate the body, i.e. With perfusion, not stabbing, but technically stabbing. So what we got to do is we got two styles of doing this. So one of them is intravenously, so into the veins. So that goes into one of the veins in the arms or a femoral vein. And basically that's putting in the catheter and we put fluid in, bolus, blah, 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 blah. The other option, if those fail twice, because they might be peripherally shunted, we have intraosseous, so that's into the bone. And that goes in 2 fingers inferior to the patella, over here-ish, in the flat median part, and we drill in, and then we add our fluids in that way. Or into the humeral head if said to do so by ALS, up here. This is the same effect, but different ways of getting it. Thank you.